So thanks so much for joining. I'm Jeni Miller, Executive Director of the Global Climate and Health Alliance. GCHA is an alliance of health organizations from around the world, over 230 health organizations at this point from around the world who come together to bring a health perspective to the climate conversation and to advocate for more ambitious climate action that protects people's health and climate policies that integrate health so as to maximally and optimally really protect people and deliver good health outcomes. We're really pleased to have you here. COP30 is coming up in just a week. There are a number of things at stake at COP30 that have tremendous bearing on the health and well-being of people around the world. And we're pleased to have the opportunity to share some of our thoughts about what to expect at COP from the point of view of health. In today's briefing, first we will hear from Dr. Courtney Howard, who is GCHA's chair of our board of directors and an emergency physician in Yellowknife, Canada. And she'll go into a bit about why climate action matters for health, full stop. I'll then come back and provide a little kind of the big picture context of health at COP30 and what's going to be on the table. And then we'll turn over to Jess Beagley, GCHA's Policy Lead, for a bit of a deeper dive into what we can expect for health inside the COP30 negotiations themselves. We'll then open up for Q&A. The briefing is scheduled for half an hour, but we're happy to stay on for another 15 minutes or so after that if there are additional questions. And please, as we go along, if you have questions, feel free to go ahead and put them into the Q&A boxes, and we'll take them up when the Q&A portion begins, as well as turn to you for additional questions at that time. With that, I would like to turn over to Dr. Howard. Over to you, Courtney.
Thanks. Hi, everybody. Thanks for joining us today. So I'm an emergency physician in Yellowknife's Dene territory in the subarctic in Canada. And when I go to work, I'm the territorial emerge doc, and that means I provide care and phone consultations and arrange medical transport for an area that's larger than France and Spain combined. We're the only CT scanner in the whole middle part of Canada. So that means that my patients, particularly those in the high Arctic, are living in a place that's warming at quadruple the global rate. Where I live, we're warming at about triple the global rate, which means that Yellowknife is already about 2.5 degrees Celsius warmer than it was when an 80-year-old elder was born. We're seeing melting permafrost, which is in fact already destabilizing our hospitals, as well as floods and severe wildfires. In 2014, we had 2.5 months of wildfire smoke that resulted in a full doubling of emergency department visits for asthma. And when we asked people what that felt like to live through that, they said, well, we had to stay inside with the windows closed for the whole summer. We felt cabin fever. We didn't get any exercise. We felt disconnected from the land. We did this study in partnership with the Kagatu First Nation and the Yellowknife's Dene, and they said, you know, our housing is already not very good. How are we going to adapt in a way that our housing stock improves so that the smoke doesn't just leak in? Many people expressed worry about what this means for their children. They said, if it's this bad now, what does this mean for my grandkids? And the thing that I thought was the most useful and is really important for our conversation right now is that the people who prepared the most felt the best. So the people who had a plan, who lined up their boats beside the highway in order to provide an alternative means of escape if the highway got blocked by fire, the people who helped fire smart their homes and their communities, they sat up straight in their interviews, they looked proud. And so what we can see is that having a plan has multiple benefits. It gives us a direction that we can travel together, and it allows us to provide concrete steps to actually improve our safety. We know that in Canada, 37% of youth say that climate anxiety is actually decreasing their daily function. Globally, youth, it's way over 50% tell us that they're worried about climate change. 80% say that they're at least a little bit worried. So we need to take a look at how we're taking care of both this generation's health and the next generation's health. In 2023, wildfires arrived so quickly that we had to evacuate our entire 100-bed subarctic hospital. I'm now sitting in Vancouver. This is thousands of kilometers south. This is where our patients were brought by the military evacuation plane that was required to evacuate our hospital. My neighbor, the territorial medical director, had to do that evacuation planet in about 3 days because we did not have a climate-informed health and vulnerability assessment. Unfortunately, that is the state for most of Canada right now, according to our Auditor General's report that came out in June. We are late in providing a national adaptation strategy. We have deeply underinvested in it, and we've only just started talking about how to roll that level of preparation out into our hospitals and health systems, let alone investing enough and building what's required. So, when I went to medical school, I really thought that I was learning how to work in the place where health happened. And I'm very, very proud of the work I do in the emergency department. But what I now understand is that our ecological foundation needs to be stable in order for us to have an economy and a society that can build, staff, and supply the incredibly complex structures that are our healthcare systems. I am now the president of the Northwest Territories Medical Association. We're 2 years out from that evacuation. It is still everything we can do to keep the doors open on our emergency departments. We made headlines across Canada just trying to keep that emerge open all summer. So what I can tell you is that even in a high income country healthcare system, when the climate impacts hit, it is an incredible stress on infrastructure, on health workforce. We can barely train people quick enough as it is. And I can tell you that the disrupted relationships and strain that resulted from that evacuation are still lingering in our medical community today, which previously had been extremely cohesive, and on our patients are huge. So as we head into COP, what I'm thinking about is the tipping point of the Amazon. We know that the Amazon is reaching a tipping point. When I'm called to the bedside of a patient who is reaching a tipping point in their physiology, what I need to do is work hard, work fast, and work effectively as a team in order to make sure that everybody is aligned in pulling that patient back to stability. We're now all living on a planet that is unstable. We need to maximally adapt, as we'll see in the Belem Health Action Plan, but that is not going to be enough. There's no way we can maintain health system function in the face of the warming trajectories we're currently seeing. People will be exhausted. We won't be able to build the hospitals as quickly as they get destroyed. The supply chains will be continuously disrupted by floods and fires. The grids will go down as a result of heat. And so really, we're looking to this moment as a chance for us to make an adaptation plan and come to a plan also that addresses mitigation. So doing that, and in recognition of the fact that the local toxic health impacts of oil sands and other fossil fuel extraction also impact patients. We live downstream from the oil sands, and they're talking about potentially dumping half-treated tailings water into the river that comes all the way past us, potentially polluting the entire northern waterway. It's time for us to transition to a clean, safe, low-carbon economy, and I'm looking forward to hearing from our brains here, Jess Beagley, and our Executive Director, Jeni Miller, about the details of what we're going to do at COP.
Fantastic. Thank you so much, Courtney, for that kind of context setting about what's at stake. And sorry. So kind of moving into what this means for COP specifically, I think what Dr. Howard laid out helps us understand why every decision in all of the areas of work that COP addresses have relevance to our health, to our healthcare systems, because our healthcare systems and our health in general depends on a wide range of sectors and on the stability and health of the environments in which we're living. Dr. Howard mentioned the Belem Health Action Plan. This is kind of the key health focus for the Brazil presidency of the COP this year. The Belem Health Action Plan, as Dr. Howard noted, focuses very much in on the things that our health systems need to do and the investments that they need in order to adapt to the climate change that we're experiencing and will be experiencing. One of the, I think, striking things about the Belem Health Action Plan is actually not just the plan itself, but the fact that for the 5th year in a row, a COP presidency has put health on the agenda and has made it something that they are focusing on. From COP26, every presidency since has recognized that climate change is a health issue and has had one initiative or another in order to elevate health in the context of the COP process. With Brazil, the Belem Health Action Plan is a key component. They also hosted the first official pre-COP event that was entirely health focused, which was a conference in July focused on health and focused on COP, an official pre-COP event. That trajectory of elevating health in the context of COP has begun to make health more and more a part of the COP conversation. We think that that's really important. Climate change is one of the greatest threats to health of our time. And every climate action that limits warming, that restores ecosystems, that builds resilience is simultaneously a public health intervention. So we feel that health should be part of the conversation, not just importantly, with respect to healthcare systems themselves, but not just with respect to healthcare systems. So COP, the heart of COP itself is really the negotiations. And that's where I think at GCHA, we see the greatest opportunities for the COP process to protect and improve lives and health and economies, because that's also an important component of healthy lives. Conversely, we see the greatest risks to health from climate change if countries fail to deliver the ambitious, equitable, health-centered climate action that is required and that is necessary. So now I'd like to turn over to Jess Beagley, GCHA's Policy Lead, to take us into, in those negotiations, in the policy making that is going to happen at COP this year. What's at stake for health? What are the opportunities? What do we expect to see? And what do we hope to see? For that, over to you, Jess, and I will pull up your slides.
Thanks, Jenny, and thanks everyone for taking the time out to be here today. So as Jenny and Courtney have already alluded to, we know that climate change is one of the greatest threats to human health of our time, and therefore the best thing that we can possibly get out of the UNFCCC process for health is ambitious climate decision making. There are 5 areas that I'll walk through today. Those are adaptation, just transition, finance, mitigation, and conflict of interest. Most of those are very much focused on the UNFCCC negotiations themselves, and then the conflict of interest issue is obviously one that cuts across what happens in all of those negotiations. Jenny, if it's helpful for me to share slides instead, just let me know.
So sorry, I thought they were shared and they were not. So let me.
Thank you.
Again. Yes, now?
Yeah, perfect. Thank you.
Great.
So to kick off with adaptation, there's a 4-year process that will be concluding at COP30. That's been 2 two-year work programs that have led to agreement on 11 targets, one of which is focused on health, and 100 indicators to support those targets that have been developed by experts. And this package of 100 indicators that's been compiled by the experts will be considered for adoption by governments at COP30. And we really need the health indicators that are in there to be maintained. They are really high quality. But we're also not going to see the progress that we need to see on those indicators that are tracking adaptation for health if we don't have means of implementation for adaptation. We can have really technically perfect health indicators, but we won't see progress unless there's those means of implementation there to support delivery of them. So that means finance and technology transfer and capacity building, which are absolutely essential if we're going to see the adaptation action that we need to protect health. On the adaptation finance side, the latest UNEP adaptation gap report projects that $310 billion of adaptation finance will be needed in developing countries annually in 2035. But not only are we nowhere near that number, adaptation finance actually fell from 28 billion in 2022 to 26 billion in 2023. That's the latest figures that we have available. And what matters here is that the populations that are most vulnerable to health hazards are going to be unprotected because of lack of adaptation, not only in the healthcare sector, but in other health determining sectors like agriculture and water. It's really crucial, therefore, that governments at COP30 agree to establish a new adaptation finance commitment as part of the GGA decision, the Global Goal on Adaptation decision, and that should be to triple a pre-existing pledge called the Glasgow target for 2025, that's tripled by 2030, which would bring us to $120 billion annually by 2030. Next slide, please. On just transition, the UNFCCC Just Transition Work Programme focuses on transitions to deliver the goals of the Paris Agreement. So that's both to reduce emissions, but also to build resilience and making sure that we're also promoting equity along the way. Current systems that we have don't serve health. We know that fossil fuels damage human health, and I'll go into that a little bit more in a moment. But also fossil fuels haven't delivered energy access, which also has major implications for health. And there are still many people suffering from malnutrition, and current agricultural systems have not delivered for health either. At the same time, the ways that we transition can also cause health risks, whether that's occupational risks from the extraction of minerals for renewable energy infrastructure, or the loss of jobs, which is a major social determinant of health, or reduced energy access, or affordable food. So at COP30, we really need governments to agree on a global mechanism for just transitions, and this can help coordinate fragmented just transition efforts and provide direct support to and mobilize finance for countries, especially in the global south. And this global mechanism is being referred to as the Belem Action Mechanism, the BAM, for a global just transition. Mechanics are very nice, but we also need the mechanics to deliver the sorts of just transition that we really need. So in addition to that BAM, that Belem Action Mechanism, we need a set of just transition principles, and those should include the safeguarding and promotion of the right to health and the right to a clean, healthy and sustainable environment, as well as maintaining and improving access to healthcare services and to social protection to make sure that populations have the amenities that they need. Next slide, please. On mitigation, again, as has already been alluded to on this call, mitigation is an absolute prerequisite to avoid increasingly severe health hazards that risk exceeding the limits of adaptation. We also need to get a handle on emissions to know exactly what we're going to have to be adapting to in the future. The latest UNEP emissions gap report that was released today finds that global warming projections until the end of the century that are based on full implementation of NDCs are now at 2.3 to 2.5 degrees Celsius, so still in excess of the Paris Agreement. And that would, of course, require climate finance to make sure that countries in the global south can deliver their conditional commitments under their NDCs, in addition to those that are unconditional based on domestic finance. Ending dependence on fossil fuels as the leading driver of climate change would not only reduce the health hazards that populations are having to face, but would also additionally avoid millions of deaths every year from air, water and soil pollution that arise as a result from fossil fuel extraction and processing and transport and combustion and waste management. So in terms of what we need to see at COP30 on this, parties really need to provide a collective response to the submitted NDCs and set out an ambitious path for implementation in the year ahead in line with the 1.5 degree limit of the Paris Agreement. There also needs to be follow-up on the COP28 call in the global stocktake for a just, orderly and equitable transition away from fossil fuels. We've got that commitment, but we now need to think about implementation, and parties should be defining a roadmap to global fossil fuel phase-out. This doesn't look the same in all countries. Global North countries should absolutely be reducing their emissions fastest and also provide finance for transitions in the global south. Short-lived climate pollutants need to be specifically addressed, recognizing the immense opportunities here, both for reduced air pollution and health gains, and also short-term reductions in emissions. and this could be done under the mitigation work programme. Next slide, please, which is my final one. On conflict of interest, we know that the presence of lobbyists from health harming and high emitting industries like the fossil fuel industry, like industrial agriculture, aviation, shipping, whose core businesses diametrically opposed to the Paris Agreement have increasingly infiltrated UNFCCC spaces. If we just look at the number of fossil fuel industry reps, we had 500 at COP26, 600 at COP27, 2,400 at COP28, slightly lower number at COP29, but a smaller conference overall. And this is in really stark contrast to what we see in other UN spaces, like the tobacco control COPs under the WHO Framework Convention on Tobacco Control, and Article 5.3 of that convention says that tobacco industry has absolutely no business being involved in tobacco control policy making. So a really stark contrast to what we see in the UNFCCC space. There are actions here that can be taken by the UNFCCC Secretariat to make sure that delegates, both of parties and of non-party delegations, are disclosing their affiliations and their funding, but also putting measures in place to respond to those identified conflicts of interest once they're disclosed. COP presidency should be leading by example, not just by not having polluting industries on their delegation, but also making sure that they're not hiring the same PR companies that serve those fossil fuel or other polluting industries, and don't give away sponsorships to those harmful industries in support of greenwashing. And finally, parties themselves should be introducing more stringent regulations and enforcement under a negotiated item called Arrangements for Intergovernmental Meetings, and should make sure that there aren't representatives from these industries on their own delegations. And I think that's it from me. Thanks very much.
You've got one more slide, Jess.
I'm so sorry, not quite that's it from me. At COP29, parties had agreed to a new collective quantified goal on climate finance, aiming to get to $300 billion by 2025. This target was completely inadequate, both in terms of quantity. 300 billion is about a quarter of the 1.3 trillion that was requested, but also the quality of that finance. It was heavily dependent on mobilization rather than provision. Provision means developed countries provide the finance, whereas mobilization means they generate momentum from other sources. The Paris Agreement is really clear that developed countries have an obligation to developing countries to provide that climate finance. There was also insufficient detail on any proportion of that 300 billion that was going to be based on grants rather than on grants and highly concessional loans rather than higher interest loans. Which really matters because the poorest countries in the world are currently spending more on debt service than they are on healthcare and education and infrastructure combined. And we know that debt reinforces cycles of poverty and disease. And we also need to make sure that if that finance is there, that it's also accessible. It's really challenging for lower resource countries to be able to access to be able to make it through the process to access climate finance. The Baku to Belem roadmap was an outcome of COP29, looking at how we can scale up this 300 billion to 1.3 trillion. We're due to see that tomorrow, the 5th of November, and we really needed to provide clear direction and assign actual responsibilities for how that climate finance is going to be scaled to 1.3 trillion, and that it's from high quality sources. And then there's another agenda item that will be discussed at COP30, which is on Article 2.1c of the Paris Agreement. And this looks at how wider financial flows need to be aligned with climate resilient pathways. A really key issue here for health is around the redirection of fossil fuel subsidies to actions that protect the planet and people's health rather than being invested in a product that really harms health. And of course, due attention needs to be given to ensuring reliable, safe and affordable energy access as parts of those subsidy reforms. But just to make the point on the fact that it was $1.3 trillion of climate finance that was requested for COP29, and that was actually the amount that was explicitly spent on fossil fuel subsidies in 2022, which is bad enough in itself, but the additional costs, many of which were health costs, of those investments because of the harm that fossil fuels cause was an additional 5.7 trillion dollars in implicit subsidies. We know that from the IMF, and in addition, another statistic from the IMF is that if fossil fuels were priced in a way that was commensurate with their true external costs to health and other damage, that 1.6 million deaths from air pollution would be avoided annually. And I think now I really am done. Thanks, Jeni.
Thanks so much, Jess. We'll start taking questions in just a moment, but the one thing that I want to note for all of you who have joined us is that the three of us and a couple other folks from the GCHA team will be in Belem for most of the 2 weeks. Some of us will be there the full 2 weeks, some of us for most of the 2 weeks. So we are available to speak to media on the ground if you have an interest in that. In addition, as I mentioned at the outset, GCHA is an alliance of organizations. We coordinate much of health civil society that participates in the COPs. And we actually have a list of other health professionals, health advocates, health researchers that will be at COP and are willing and available to speak to media. So if we don't have expertise in an issue, or if you're looking for somebody from a particular perspective on a particular topic or particular geography and that sort of thing, we might be able to help you connect with someone. And with that, I will now take a look at the Q&A box and invite people to ask us questions. So we have a question from August Rick that says, can you say a bit about the challenging strategy of developing and implementing adaptation plans while still strengthening our research understanding of how climate impacts our health and incorporating these findings on a moving basis? How to view the strategy on this moving forward? I'm thinking of non-communicable diseases and autoimmune diseases in particular, which are currently not mentioned or among the least mentioned risks in this year's NAP and HNAPs. I think that's probably meant to be HNAPs, according to the WHO analysis. Courtney, do you want to talk a bit about the process of developing adaptation plans while there's still sort of ongoing research? And, we know the climate is, we're in a phase where it's still continuing to change. We're not at a stasis or a new normal. So new data and new research is required on an ongoing basis to enable us to adapt. And meanwhile, we're having to adapt in real time. I think you've played a significant role in Canada in developing some of the thinking around adaptation for the health system nationally. Do you want to take a first pass at that question?
Sure. So I was on the Disaster and Emergency Risk Reduction Table of Canada's National Adaptation Strategy Development, and there was a health table as well, economy, several others, nature. The reality is that in most countries, there's tons of research we haven't yet acted upon. And when I was later asked to develop a roadmap for implementation of a declaration on planetary health that Canada's medical school deans have now all signed, I did a landscape assessment and a gap analysis of the entire medical sort of community in Canada. And the reality is, and this is backed up by multiple curriculum assessments done over the years and published, is that most doctors still don't know what they don't know about climate change, period. So it was just October, earlier in October, that we had probably our first national meeting on climate change and health in Canada, where we had the Royal College presidents, we had the president of the Canadian Medical Association, we had the president of the Canadian Nurses Association, all in one room, looking at one another in the eye and saying, we need to take this on. We need to figure out how climate change is already affecting health and health systems, because I'm still getting questions from my colleagues saying, Dr. Howard, is this a new normal? And I'm like, you have not looked at the graph. We are there. There's no flat line on the graph. The graph in terms of temperature keeps going up. And so at this point, the biggest limiting factor is we don't share a common vision of the future. And we need to quickly upskill. And so in Canada, we've now decided we need to create a national resource center for planetary health that holds functions of practice, research, and policy, so that we can very quickly build the new structures required to even help people understand where we're already at. So your question is lovely, and I appreciate it very much, but it underlines really the deep lack of preparation that we've currently got. And I have to say, that has to do with fossil fuel misinformation. Doctors have been marinating in the same information environment that the rest of people have been in. And we saw that when an anti-greenwashing act was passed in Canada last year, the fossil fuel company websites went black for a number of days because all of a sudden they were going to be held accountable for evidence-based information. So that non-evidence-based information has been going to our policymakers, it's been going to our physicians, it's been going to our public. And so people are currently making decisions based on erroneous information at all levels. And so that's one of the reasons why what Jess is talking about in terms of fossil fuel influence is so deeply, deeply important at all levels. So yes, we're lacking a ton of data, but we haven't even acted on the data we've got.
Yeah, Jess.
I'd love to just add a tiny bit to what Courtney said and say that of those 11 targets that I talked about in the Global Goal on Adaptation, there are 4 that are related to the adaptation cycle, and we'll look at things like whether or not vulnerability and adaptation assessments are being conducted before heading into national adaptation plans and health national adaptation plans as part of that. And then just to mention WHO's Alliance for Transformative Action on Climate Change and Health, which I know has lots of exchange of good practice at making sure that different health issues are addressed in health national adaptation plans, because we know they are absolutely all linked in one way or another to the climate crisis. Thanks.
And the one additional thing that I'll add is that there actually is now new investment in making climate data accessible and available for health systems. The WHO and the World Health Organization and the World Meteorological Organization have a partnership that is focused precisely on that, making meteorological data and those kinds of projections that enable us to anticipate what's coming down the road, making that data available in a way that's accessible, comprehensible, and useful for health systems in order to be able to prepare and adapt. A lot of work needs to be done to enable health systems to actually then take that information and use it. But some of that work is already being recognized as an important need and beginning to be underway. I saw a hand from Fiona. Would you like to jump in? Oh, I think Fiona has jumped off. Other questions? Dave, did you want to come in? That was a straight
No, I was
hand.
just testing.
Oh, okay. Any other questions from anyone? Okay, if there's no other questions, we will wrap here. We'd be delighted to run into you at COP. We would be very pleased if you find yourself at COP, if you would pay attention to the health implications of the decisions being made there and think about reporting on them. We think it's vitally important that people really understand the human implications of the decisions that get made there. And I think that sometimes gets lost in the technical language and the technical work there. But every single decision made at COP has implications for people's health. There's some directions that are better for health, some that are worse. Clearly, it's vitally important that ambitious action on climate change be taken just to preserve a livable planet. So we think it's really important for kind of people at large to understand that that's what COP negotiators are negotiating. They're negotiating people's lives and people's health. So with that, I will bring this press briefing to a close and hope to see you in Belem. Take care, everyone. Have a great rest of your day or evening.